Curative asanas for low blood pressure. SALAMBA SIRSASANA 1. Kneel on the mat. Rest the forearms on the center of the mat. Interlock the fingers right up to the fingertips. Rest the crown of the head only on the mat so that the back of the head touches the palms, which are cupped. After securing the head position, raise the knees from the floor by moving the toes closer to the head. Exhale. Take a gentle swing from the floor and lift the legs above the ground with bent knees. Take the swing in such a way that both the feet leave the floor simultaneously. Stretch the legs and stand on the head, keeping the whole body perpendicular to the floor. Stay in the pose for 1 to 5 minutes according to your capacity. Beginners must have the assistance of someone. Regular practice of Sirsasana make healthy, pure blood which flow through the brain cells. Highly therapeutic for asthma, infertility and insomnia. Relax. Lower the legs and sit in Dandasana. SALAMBA Sarvangasana 1. Lie flat on the back, keeping the legs stretched out, tightened at the knees. Place the hands by the side of the legs, palms down. Exhale. And at the same time, raise both the legs and bring them at the right angle to the body. Remain in this pose and inhale, keeping the legs steady. Exhale again. Raise the legs further up by lifting the hips and back from the floor, pressing the palms gently against the floor. When the whole trunk is raised above the ground, bend the elbows and place the palms on the back of the ribs, resting the shoulders well on the floor. The elbows should not be placed wider than the shoulders. Try and stretch the shoulders away from the neck and also to bring the elbows close to each other. Only the back of the head and neck, the shoulders and the upper portion of the arms up to the elbows should rest well on the floor. Remain in this pose for 5 minutes to 6 minutes. Continuous practice of SALAMBA Sarvangasana 1 eradicates common coids and other nasal disturbances. This asana is recommended for urinary disorders, menstrual disorders, piles and hernia. Release the hands, slide down to the floor, lie flat, and relax. Halasana. Perform Niralamba Sarvangasana 1. Release the chin lock. Lower the trunk slightly, moving the arms and legs over the head and resting the toes on the floor. Tighten the knees by pulling up the hamstring muscles. At the back of the thighs and raise the trunk. Place the hands in the middle of the back and press it to keep the trunk perpendicular to the floor. Stretch the arms on the floor in the direction opposite to that of the legs. Hook the thumbs and stretch the arms and legs. Interlock the fingers and turn the wrist so that the thumbs rest on the floor. Stretch the palms along with the fingers. Tighten the arms at the elbows and pull them from the shoulders. The legs and the hands are stretched in opposite direction, and this stretch the spine completely. Remain in this pose for a minute or two. The effect of Halasana is the same as that of Sarvangasana 1. In addition, the abdominal organs are rejuvenated due to the contraction. This asana is good for people with a tendency of high blood pressure. Relax. Lower the legs. And lie down in Shavasana. Relax for a while. People suffering from high blood pressure, the following technique is recommended for doing Halasana. Before they attempt SALAMBA Sarvangasana 1, lie flat on the back. Exhale. Slowly raise the legs to a perpendicular position and stay there breathing normally for about 10 seconds. Exhale. Bring the legs over and beyond the head and touch the toes on the floor. Keep the toes on the floor and the legs stiff at the knees. If you have difficulty in keeping the toes on the floor, then place a chair or stool behind the head and rest the toes on it. If the breathing becomes heavy or fast, do not rest the toes on the floor but on the stool or chair. Extend the arms over the head. Keep them on the floor and stay in this pose with normal and even breathing for 30 seconds to a minute. This asana strengthens and opens up the neck, shoulders, abs and back muscles. Calms the nervous system, reduces stress Throughout this asana, gaze at the tip of the nose with the eyes shut. Relax. Lie down in Shavasana. Karnapidasana 1. Perform Halasana. After completing the time limit for that pose, flex the knees and rest the right knee by the side of the right ear and the left knee by the side of the left ear. Both the knees should rest on the floor, pressing the ears. Keep the toes stretched out and join the heels and toes. Rest the hands either on the back of the ribs or interlock the fingers and stretch out the arms as in Halasana. Remain in this pose for half a minute to a minute with normal breathing. Karnapidasana stretches and strengthens your backbone, gives strength to the lungs, and also beneficial for asthma patients. Controls hypertension and stretches and stimulates the abdominal organs and thyroid glands. Relax. Slide down to the mat and relax for a while. Paschimottanasana Asana. Sit in Dandasana. Place the palms on the floor by the side of the hips. Exhale. Extend the hands and catch the toes. Hold the right big toe between the right thumb and the index middle fingers, and likewise the left big toe. Extend the spine and try to keep the back concave. To start with, the back will be like a hump. Learn to bend right from the pelvic region of the back and also to extend the arms from the shoulders. Now, bend the widened elbows using them as levers. Pull the trunk forward and touch the forehead to the knees. Gradually rest the elbows on the floor. Stretch the neck and trunk. Touch the knees with the nose and then with the lips. When this becomes easy, make a further effort to grip the soles and rest the chin on the knees. When this also becomes easy, clasp the hands by interlocking the fingers and rest the chin on the shins beyond the knees. When this position becomes easy, grip the right palm with the left hand or the left palm with the right hand. Keep the back concave. Exhale and rest the chin on the shins beyond the knees. Now hold the right wrist with the left hand or the left wrist with the right hand. See that the back of the legs at the knee joints rest firmly on the floor. Try to stay in this pose for as long as you can. Advanced age pupils may extend the hands straight. Rest the palms on the floor. Join the thumbs beyond the outstretched feet and rest the chin on the shins. Stay for a minute or two with deep and even breathing. This asana tones the abdominal organs and keeps them free from sluggishness. Also tones the kidneys, regenerates the whole spine and improves digestion. Inhale, raise the head and sit in Dandasana. Virasana. Kneel on the floor. Keep the knees together and spread the feet about 18 inches apart. Rest the buttocks on the floor but not the body on the feet. The feet are kept by the side of the thighs, the inner side of each calf touching the outer side of its respective thigh. Keep the toes pointing back and touching the floor. Keep the wrist on the knees, palms facing up. And join the tips of the thumbs and forefingers. Keep the other fingers extended. Stretch the back erect. Stay in this pose as long as you can with deep and even breathing. Then rest the palms on the knees for a while. Now interlock the fingers and stretch the arms straight over the head, palms up. Stay in this position for a minute with deep breathing. This asana is good for meditation and pranayam. Also cures rheumatic pains in the knees and gout, and is also good for flat feet. Exhale, release the finger lock, place the palms on the sole, bend forward and rest the chin on the knees. Stay in this pose for a minute. Inhale, raise the trunk up and relax. Sit in Dandasana. Siddhasana. Sit in Dandasana. Bend the left leg at the knee. Hold the left foot with the hands. Place the heel near the perineum and rest the sole of the left foot against the right thigh. Now bend the right leg at the knee. Place the right foot over the left ankle, keeping the right heel against the pubic bone. Place the sole of the right foot between the thigh and the calf of the left leg. Do not rest the body on the heels. Stretch the arms in front and rest the back of the hands on the knees so that the palms face upward. Join the thumbs and the forefingers and keep the other fingers extended. This is known as Janana Mudra. Hold this position as long as you can, keeping the back, neck and head erect and the vision indrawn as if gazing at the tip of the nose. Now Release the feet and relax for some time. Then repeat the pose for the same length of time, now placing the right heel near the perineum and then the left foot over the right ankle. With the hands in Janana Mudra, Siddhasana keeps the pubic region healthy like Padmasana. It is one of the most relaxing of asanas. The body being in a sitting posture is at rest, while the position of the crossed legs and erect back keeps the mind attentive and alert. This asana is also recommended for the practice of pranayama and for meditation. From the purely physical point of view, the asana is good for curing stiffness in the knees and ankles. In it, the blood circulates in the lumbar region and the abdomen. Relax, unlock the legs and sit in Dandasana. Padmasana. Hold the right foot with the hands and place it at the root of the left thigh so that the right heel is near the navel. Now bend the left leg and holding the left foot with the hands, place it over the right at the root, the heel being near the navel. The soles of the feet should be turned up. This is the basic Padmasana pose. People not used of sitting on the floor seldom have flexible knees. At the start, they will have exuding pain around the knees, but will gradually subside and they can stay in the pose for a long time. Change the leg position by placing the left foot over the right thigh and the right foot over the left thigh. This will develop the legs evenly. After the initial knee pains have been overcome, Padmasana is one of the most relaxing pose. The body being in a sitting posture, it is at rest without being sloppy. The position of the crossed legs and the erect back keeps the mind attentive and alert. Hence, it is one of the asanas recommended for practicing pranayama. Relax, unlock the legs, Surya Bhedana Pranayama. Sit in any comfortable position like Padmasana, Siddhasana or Virasana. Keep the back erect and rigid. Lower the head to the trunk. Rest the chin in the notch between the collarbones just above the breastbone. Stretch the left arm. Rest the back of the left wrist on the left knee. Perform Janana Mudra with the left hand. Bend the right arm at the elbow. Bend the index and middle fingers towards the palm, keeping them passive. Bring the ring and little fingers towards the thumb. Place the right thumb on the right side of the nose, just below the nasal bone. The ring and little fingers on the left side of the nose, just below the nasal bone, just above the curve of the fatty tissue of the nostrils. Press the ring and the little finger to block the left side of the nose completely. With the right thumb, press the fatty tissue on the right side so as to make the outer edge of the right nostril parallel to the lower edge of the cartilage of septum. The right thumb is bent at the top joint and the tip of the thumb is placed at a right angle to the septum. Now inhale slowly and deeply, controlling the aperture of the right nostril with the tip of the thumb nearer the nail. Fill the lungs to the brim. Then block the right nostril so that both are now blocked. Hold the breath for about 5 seconds while practicing Mula Bandha. Keeping the right nostril completely blocked, open the left nostril partially and exhale through it slowly and deeply. This completes one cycle of Surya Bhedna Pranayama. Continue with more cycles at a stretch for 5 to 10 minutes according to your capacity. All the inhalations in Surya Bhedna Pranayama are from the right nostril and all the exhalations from the left nostril. Throughout the process, the passage of air is felt at the tips of fingers and the thumbs and in the nasal membranes where pressure is applied. Persons suffering from low blood pressure will derive benefit, but those with high blood pressure or heart trouble should not hold their breath after inhalation. Each inhalation and exhalation should last for the same length of time. Relax. Lie down in Shavasana.